It is another edition of your favorite program, Health Affair on AIT, and I'm your regular anchor, Ushuomowa Daniels. You're welcome. On the program, everything about health is our concern. We also focus on issues about women and children with the aim of finding lasting solutions. On this week's edition, we shall be focusing on chemicals used in food preservation and its health implication. Let's take you through our new segment for that.
To improve the life expectancy of Nigerians and reduce increasing death rate from cardiovascular diseases, health experts have advised Nigerians to cultivate the habit of walking 30 minutes every day and eat right. The experts were speaking in commemoration of the 2022 Fitness Day in Lagos with the theme, Life is Better in Motion.
For so long, I'd been keeping fit for a bit, and at some point we got sick and tired of hearing gone too soon, gone too soon. And we thought we needed to do something about it, knowing that it's actually easy to be able to stop people from going too soon. We're going to die at some point, but again, there's no need to rush out of earth. Life is fun to live. So we thought, why not share what it is we're doing with the rest of the world? And it's very simple. We tell our members in 30 countries in the world and many cities in Nigeria to do two basic things. To walk, waka, 30 minutes every day, and to eat right, eat sensibly, in small portions, and get enough sleep, enough good quality sleep. Waka community is about changing lives, one waka at a time. Most people don't know this though, but walking is one of the best kept secrets in the world. Walking has humongous benefits, including but not limited to the following. It helps us maintain healthy weight, helps us keep away unwanted fats, helps us keep away a couple of cardiovascular diseases, heart issues, helps us keep away from diabetes, from arthritis, and boosts our mind and our mood. So talk of mental health issues, walking is there for you. And for those who are living with glaucoma like I am, which has no cure right now known to man, walking helps you maintain the eye pressure. Most people don't know this, but walking is good for your vision.
Please, everybody walk. We just walk. Walking is a great exercise. It's free. You've got the paths, the roads, the parks to walk, and it helps your health. Walking is the simplest way to keep healthy. Doctors will recommend that, for example, if you can walk 30 minutes every day, then number one, issues, common things you experience like cold, all those things, it helps you to build immunity against those small ailments, and so it's the easiest way to keep fit.
They also educated the public on basic emergency tips to help resuscitate victims of cardiac arrest and other life-threatening conditions.
Emphasize on healthy living, but also to bring it to the attention of Nigerians that you can do something to make a difference. Heart attack, cardiac arrest, and other first aid situations. Many Nigerians have heart attack, nobody knows what to do. They are pouring water. Pulmonary resuscitation, that's CPR, AED, and how to handle emergencies so that we can save more lives. Many lives actually die before they get to the hospitals. So with the tips people will get today, we know that many will go home with knowledge on how to save their loved ones. Many will know what to do when in the office or at church or anywhere else. So we call on Nigerians, let's work with HEI, let's work out together with Waka community, let's collaborate to save more lives. And we can see the spirit of community that is working today. So we look forward that a better nation would emerge from this work. And corporate organizations, of course there are many corporate organizations that have supported us. Some have given money in different ways to train even secondary school students. Some have given money to take care of children in various hospitals. I want to end with this testimony. In one of the biggest children's hospitals in Lagos, we got a report last December that for the first time in many years, the number of mortality they recorded reduced significantly because we got funding from some corporate organizations who gave dedicated assistance to this hospital. So we want to see more reports on that. Otherwise, we'll see many of our children dying before they are 5 years. God bless you.
National Fitness Day is celebrated first Saturday in the month of May every year to promote mental health and physical
under the guise of wanting to operate at the higher realm of spirituality due to peer pressure and other various reasons. Many Nigerian youths in their productive years have been caught in the web of abuse of drugs intake like cocaine, heroin, cannabis, amphetamine-type stimulants, inhalants, and solvents such as glue at the detriment of their health.
Some of the youths, they have got their destiny wasted. Some have died in the process. Some are run mad. So you see that the effect is great on our society. If trends continue like this, we are going to have a confused society, a confused system. One of us must rise to the challenge. It's a war that we must win.
Most of us, we have failed when it comes to parenting. Like as they said, train a child in the way it should go. When the time he grows, he will not depart from it. While we were growing, you can see that we were raised by a community that belongs to everybody. Sees you, they contribute, positively to you. But the case is not the same thing this time around, because we want to be a professional. I want to be a professional in my field. You want to be a professional in your field. So we left those children at the hands of the nanny, maybe your siblings or your brothers or whatever. And you see that they give them the wrong information. They impact negative into their lives. So these children, they are suffering from our failure, because we are not doing the needful as parents. So we still have to go back to the basics, so that we can be able to say, we form a kind of bond with our children. It's no longer there. Some of us now, like you now, maybe we enter your house by 12 midnight. There's no relationship. So these children, they want everything, because most of my clients, they will say, Madam Titi, I want affection from my parents, but I'm not getting that. All they want is what? Gift, money. That's what I need. I want affection and love. Are we there to give it to the affection and love to these are our children? Let's search ourselves.
Well, we have to adopt a multi-dimensional approach. We have been following it from one angle, but if there's going to be performance, if there's going to be success, then it must be attacked from different angles. Understanding that substance abuse is biological, is psychological, is social, is economic, and we must address it all round.
Beyond the health implication of drug abuse, there are other psychological and socio-economic implications, which experts say have overall negative impact on the future generation.
The effect of drug abuse or the drug abuse is beyond physical, is backed up by the spirit. And that's why the role of the church is very, very important. Looking at how to handle this from spiritual point of view and then from physical point of view, to see how we can deliver and rescue our youth from this effect.
We make laws, and these laws are not enforced the way they should be enforced. Of course, no matter how much we say, there will always be loopholes, and what we are looking for, the result we are looking for, will be absent.
Though there are legislations in place to serve as deterrent for drug addicts, the experts want tougher punishment with more parental and religious leaders' involvement in the activities of youths to ensure prevention, which they say is better than the cure of rehabilitation for drug addicts.
Children are born, especially in the second or third month of life, when they have a hole in the heart and then there's increased blood flow into the lungs, they tend to breathe fast. So a baby that breathes fast, that is not able to drink milk from the mom without tiring out, that gets admitted often with infection in the lungs, respiratory infections, they're a sign of a cyanotic heart disease or increased blood flow to the lungs because of a hole in the heart.
Heart diseases are those diseases that affect the cardiac structure. The prevalence of heart diseases is on the rise in Nigeria, as shown by recent studies done in southwestern Nigeria of children presenting with the condition in tertiary hospitals, put at 83.69%.
My child had ASD and VSD, which means two large holes in the heart. She had delayed milestones. She's my second. Like my first, it was fast with everything, but she had delayed milestones. We kept watching to see how she was doing, and then her breathing was very fast and all that. So mothers should be very, very watchful, should be very, very observant with their kids.
So when the baby is inside the mom, very important to avoid viral infections, and if you get a viral infection or any fever, to report it to your doctor, because some viral infections can damage the heart of the baby. The other important thing is to avoid x-rays or drugs. Both these things should be only with the permission of your doctor, because the baby is very vulnerable when it's inside the mother. And if the mother is diabetic, it's important to closely monitor the baby.
Educate the public. Once you educate, most of the problems are solved.
The cost of treating these diseases is better imagined than experienced, as it puts a huge financial burden on parents. To find a lasting solution to this challenge, the experts want government to build the capacity of medical personnel to save capital flight and reduce medical tourism.
We are willing to train the doctors to give them more education. They are welcome. I mean, urologists are welcome to come train with us for a few months. We can at least help them deliver better technology or newer technology or newer techniques to help people more. Government will also have to back them to give them more facilities.
The experts also expressed worry over the increasing cases of renal failure amongst Nigerians. They called for lifestyle modification and regular health check.
The leading cause of renal failure in India or across the world now is uncontrolled diabetes and uncontrolled hypertension. One of the other things is people popping painkillers. To just take painkillers like how they take, I saw that, the tom-tom, the lozenges. They just pop in like, okay, I have a headache, I have a leg pain, let's just pop in a lozenges. Let's pop in a painkiller. We have to take care of our own eating habits, our own sugars, our blood pressures, our antihypertensive medication, and go regularly to a doctor. Make sure you go for a preventive camp. Whether you have a problem or no, everybody after the age of 45 or 50 should go to a doctor and get themselves examined every year, so that you prevent something which can creep up without your knowledge. You prevent things which can go wrong just by taking care from now.
Cooked food, drinks like local juice, popularly called zobo, and several others are sold in the open market, motor parks, schools, and several corners across Lagos State by food vendors, many of whom are not knowledgeable about food safety practice, thereby exposing millions of residents to foodborne diseases. It is to prevent this avoidable disease spread and death that informed this public gathering and call for action to educate food handlers.
Without food, survival is very difficult. So everybody must eat on a daily basis. But also food is could be a way of introducing infection and disease into the human body. So we talk about food safety and food security. And we know that there are quite a number of foodborne diseases. Some of the diseases that are ravaging Nigeria and are leading causes of death also come from the food we eat. Maybe not directly the food itself, but contaminated food that we eat. And we believe that we need to look at that direction to reduce illness due to food contamination and also death due to food contamination. And in order to be able to do this effectively, we look at food handlers, those who sell food for others to eat.
Vibrio cholerae, you all know the rice water stool, because they have taken maybe food contaminated with feces. That's one very common one. Then another common one is salmonella. I spoke about how I did one study in Ojo local government like 15 years ago. We were screening some food handlers for salmonella typhi, and 6% of them, that is 6 out of the 100, were positive for salmonella typhi, and they are carriers. They don't, the other speaker, Dr. Ladele, explained about typhoid Mary. They don't come down with those symptoms. So, but people that don't have them, when they get to those people, they transfer it. And the other person can actually come down with salmonella typhi and develop typhoid fever, which can lead to complications.
It's key. Food is central to our living. Everybody eats several times a day. So if we are doing it right, then we are doing the right thing. But if we are doing food wrong, then we are putting ourselves at risk every day. Food can save life, but food can also cause disease and death. So for our food handlers today, for me, the most important message is that of washing your hands, hygiene. If nothing else today, if you learn nothing else today, learn that one and practice that one of repeatedly washing your hands. Also, we learned today about the impact of carrying diseases like typhoid in our body as carriers. We're not sick and yet we're spreading the disease. So it's important that our food handlers are tested regularly, that we have a platform for accessing them and taking samples from them to see if they are carriers and treating them even when they are not sick.
Who die as a result of consumption of inappropriately prepared food or food that are chemicalized or people that are prepared from substandard sources. So the advice of government is that as research institute that NIMA is, we will continue to scale up our research activities. Whatever we find out, we inform policy modification or policy implementation. So that's on the part of researchers that NIMA is abundantly blessed with. On the part of state government and local government area, they have local government chief executive and authorities. They have to scale up their supervisory activities. There was a time we wanted to buy wine, non-alcoholic wine for a function. And we were told that the people have a lot of unregulated outlets where such drinks and food are prepared. And only God knows what happens when such people, and the consequences may not be immediate. It may be a long-lasting consequence. So this oversight supervision of those restaurants and eateries and various places where they sell food must be scaled up.
The initiative, which is aimed to be on a regular basis in Lagos, is a good example experts say should be replicated in other states across the country.
For us, this is a research opportunity to provide information for public health use, for government to come up with relevant policies on these people.
This is not the last of the training. We are going to be doing consistent training of the food handlers. And we intend to, like somebody mentioned, intend to have guidelines written in both Yoruba, Pidgin, and English. So we intend to get back. You know, this was funded by the Right Honorable Femi Gbajabiamila. So he's trying to reach out to his constituency, and not only that, to Lagos State as a whole.
Food commonly associated with diseases include raw foods of animal origin, fruits and vegetables contaminated by animal waste, unpasteurized fruit juice, and food items that is touched by a person who is ill with vomiting or diarrhea.
The Pharmacists Council of Nigeria is a federal government parastatal established by Act 91 of 1992. The agency is charged with the responsibility for regulating and controlling pharmacy education, practice, and training in all aspects and ramifications throughout the Federation. When pharmacist Mohammed Elijah assumed duty as the Registrar of the Pharmacists Council of Nigeria on June 12, 2014, he had a clear picture of what he wanted to do with his 4-point agenda as follows: to reposition the registry for effective service delivery, to institutionalize good pharmacy practice in Nigeria, to transform career professionals to intellectual practitioners, and to promote new partnership for progressive initiative.
Here is a double Elijah who struggled through life, but who today is being celebrated. There is an Elijah who became the registrar of the BCN in a competition of 35 equally brilliant people. Here is an Elijah who, when he was BCN registrar, when he came there, the pharmaceutical narrative was negative. But he came there, he saw there, and conquered there. The development in the BCN, as Maura would confirm, in the past few years has been unbelievable. The kind of thing that Napoleon describes as développement incroyable is a development that's unbelievable. But he did that because the grace of God was following him. Not because it's anything too different. But each time the favor of God arrives at your desk, if you are awake and ready, it makes you a different person. May the favor of each and every one of you find you this year.
The name of Dr. Mohammed will certainly be written in gold as we write the history of pharmacy in Nigeria for what he has accomplished. This event of book presentation in his honor is one of such historic events.
Elijah Mohammed, a man who has demonstrated capacity to be able to serve. Service is so important. That position is about serving the people, ensuring good health through promoting the good practice of pharmacy on the desk that determines who practices pharmacy and what rules guides the practice. He does not play any ambiguity in that area. He's straightforward, he's tactful, full of wisdom, very humble, loyal, and indeed very political in his thinking. So he knows how to play the game right to the benefit of the people and the profession.
He's a very good man, he's a professional to the core, has been a good civil servant, and has added value in his days as the Registrar of Pharmaceutical Council of Nigeria to the pharmacy profession and to Nigeria as a whole. So it's a beautiful day and a day that we are all here to honor him, and we are proud and glad that we are here.
Taking off from where he is coming from, I have a responsibility not only to sustain, but to make sure that we take to greater heights this foundation that he has laid.
A very jovial personality, very amiable, very friendly, very cooperative, always willing to assist. He's my very good friend, and I'm happy to be associated with him. And that's why we have all committed ourselves today, honestly, to give him a very grand event. I'm happy that things are moving quite well.
He just came at a time when we needed somebody to change things. And he came and he transformed PCN. When we say PCN, transforming PCN is like transforming the institution itself and then transforming pharmacy practice by what the institution was able to do, all over Nigeria. Okay, situations where you have issues with premises that are not registered. You can call them fake premises. People just come, set up. He is now making sure that everything is very orderly. Okay, for the practice of pharmacists, like you heard, you need an annual license to practice. And sometimes in the past, some of these licenses takes up to 8 months or 9 months. You are getting your license by July, August, okay, in a year that has started like January. But right now, these things are done seamlessly. You get your license, you practice.
One of the biggest lessons of the life of Mohammed is that people should learn to stick to their focus, their goals, their targets in life. There's always a need to potentiate your potentials, and you can see that from a most humble background as a hawker of all sorts of commodities, he's been able to get to the very apogee of his profession, and he's distinguished himself.
The double prophet is really a bridge builder. You know, to bring the pharmacy profession to the next level. A lot of things have been automated, like our registration have been made a lot easier during his tenure. So many things, have been done in a very transparent manner. So he's really proven that he's a transparent person, he's a man of truth, a man of proven integrity. And we pray, my prayer for him is that he's going to move from height to height, from greater glory to greater glory. That's my prayer for him. It's just the beginning for him. So he's going to be called in for a higher service by God's grace.
When I was president of the Pharmaceutical Society of Nigeria, he worked with me as the national secretary. And I knew about his capacity and integrity. And that came to bear in this job that he did for the past 8 years. And so you can see why I mentioned that I'm one of the happiest persons. That one we knew, we recommended, performed, and also going to hand over to another hardworking person.
When the grace is upon you, you have to be strategic in your thinking, in your action, and in your deeds. So what the philosophy there is that working with people, you have to understand the people, understand their weaknesses and strengths, leverage on their strengths so that you can move the system forward, and then help them out from their weaknesses so that they can now be able to key into whatever project you have.
Having recorded a great level of success and even exceeded the set goal, pharmacist Elijah Mohammed decided to bow out when the ovation is loudest with a book titled The Transformative Leader.
As at April last year, he was recognized among 25 other leaders in the country in the various sectors of Nigeria economy as one of the transformative leaders. And this preceded the writing of the book. So for me, multiple organizations recognize him as a true transformative leader is a confirmation that is truly transformative. And we look at the quality of the audience here today and the testimonies that they have shared concerning his humility, his approach to engaging various stakeholders, his ability to respond to the needs of various stakeholders, from workers to pharmacists to pharmacy technicians to fetal medicine dealers. And at times, the needs of these people are diverse, and they are not just diverse, but they are in conflict. And he's able to talk to each group and find a good base to be able to work with all of them. That for me makes him a very solid technocrat and a truly transformational leader.
When people read it, they will understand the regulation of drugs, pharmacy practice in Nigeria. That's one. Two, they will get to know that going forward, we will no longer have pharmacists that have just the Bachelor of Science, Bachelor of Pharmacy degree. They would not have the Doctor of Pharmacy degree, which, focuses on patient care more. What we have now is focused mainly on drug production. But the best drug practice today is on patient care, whereby pharmacists will talk with, sit with patients the same way doctors consult patients and sit with them and find out whether the diagnosis is working, whether the prescription is working. But now with doctors of pharmacy sitting, they would also have a closer interaction with patients, and that will reflect in how drugs are managed.
Honestly, each and every one of us will learn a lot of lessons, leadership experiences, after going through that book. So I wish you have your time, take your time, go through the book, and I think you'll come out more better after reading his book. I wish him God's grace, abundant grace, and more favors, good heads, because what lies ahead is far greater than what we are seeing today.
I've been under his wing for a pretty long time. If you check page 48 of the book, or thereabout, I did say one or two things about him. More like taking a step. Every time I take a step, it's after him, because it's directly my senior. So wherever he put his legs, I choose to follow him on that path. So all the things they said about him this afternoon were not surprising to me, because it was actually a reflection of who he is.
Pharmacist Mohammed Elijah got his Bachelor in Pharmacy degree in 1984 from the prestigious Faculty of Pharmacy, University of Benin, Edo State, Nigeria. In 1997, he had his MBA from Ambrose Ali University, now Edo State University, Epoma, and a Master's of Science in Health Management from the University of Lagos in 2008. In the year 2020, pharmacist Elijah Mohammed backed his PhD in Public Health Policy, Walden University, Baltimore, Maryland, USA. Currently, he is a postdoctoral student at Atlanta International University, Honolulu, USA, with special interest in policy development, implementation, and leadership in healthcare. He is happily married and blessed with children.
He's a man that knew why he was created early enough in life. He had a vision, and he made up his mind to fulfill God's purpose for his life. I wish him more opportunities to make a difference, as he has made a difference in his capacity at the moment as the Registrar of the Pharmacists Council of Nigeria.
He has set the country in different capacity
with a record of excellence. The preservation of food items like grains, beans, and ripening of fruits with chemicals has been identified by the National Agency for Foods, Drug Administration and Control (NAFDAC) as a major cause of increasing disease burden, especially non-communicable diseases like cancer, kidney failure, and lots more. I spoke with some experts about the issue. Please take a listen.
We found out over time, and there's been this outcry from a lot of our citizens that there's been an abuse of so many areas. Take, for example, food commodities, food, NAFDAC regulates food. We found out that a lot of people are misusing chemicals to preserve most of our foods. We find out that not only do they misuse them, some of them apply them wrongly. I'll give you some examples. Take, for example, in beans, pesticides, for example, you find out a lot of them when you go to buy beans, for example, you see that they apply, chemicals directly on this, on this produce, and at the end of the day, it's like those things they really endanger their life. And so that is one area when we're talking about food. So we see a lot of cases like that. We see people using dyes to make their palm oil look bright, nice, yellowish, and all that. And these things, sometimes they contain dyes that are carcinogenic in nature. And so we have so many of our products like that. You cannot even have confidence in the oil you buy. Even the meat that you buy in the market, you find out that your meat is also, we use some kind of preservative. They use chemicals on it so that you would not have decay of that meat. So even the meat you're taking, the fish you're taking, the chicken you're taking, you cannot even guarantee what is happening. Because people do not, they don't understand that they are endangering the lives of our citizens. That is one area. Then you have also another area where you're talking about even drugs itself. A lot of people tend to buy their drugs from patent medicine stores. Usually patent medicine stores, they sell more of over-the-counter, paracetamol, very simple drugs. But we found out that all these very serious drugs that can affect, that are used for very serious conditions. People just abuse them. And so before you know it, you begin to develop resistance against whatever organism maybe you're trying to fight, if it's an infection that you have. And then even in this era of COVID, you see that when people have COVID is not a death sentence. COVID is it's in a class that is very equivalent to cold, to make it very easy for people to understand. And instead of trying to go to your doctor to find out, first of all, to test if you have it, so that you can use the right drugs for it, people prefer to be in denial, and they just use different things. They just say, antibiotics will do this. Antibiotics will take care of the virus. Let's take different medications, even concussion and all that. People just take different things. So we realize that there's so much abuse, even this period of COVID, that people just take anything. And they don't know that they're destroying their organs. People just buying things from buses, buying anywhere they see drugs, without even imagining if this drug is really safe for use or if it is effective. And of course, because like I say, if you're using all these very ethical products, that is when I talk about ethical products, I'm talking about products that are therapeutic in nature, that if you do not use them, properly, of course, it could even lead to death. But people don't go to the right places. They don't go to the doctors to get their prescriptions. They just self-medicate. So we have cases like that. And then you have even, like I mentioned, meat, for example. You know, there's a link between meat, man, environment. People just consume, because we all go to the market. And so now we have just realized that we're even having some kind of antimicrobial resistance. People are beginning to, because sometimes you think that your problem is just from the drug you take, from the meat you consume. Because most of that meat, like I said, they contain things in them that should not be there. And of course, it will affect you. So we have a lot of antimicrobial resistance issues. We have the drug abuse issues. We have, of course, the misuse of chemicals.
Traders generally, those who are selling fruits, use chemicals to ripen their fruits. Fruits like bananas, plantain, you find out that they use calcium carbide, which is a chemical that is supposed to be used by welders to weld metals. You find out because it mimics the natural ripening chemical in fruits. They now add it to the fruit just to get it quickly to the market. They don't want to allow it to ripen the natural way. And you find that people buy those fruits, like you can be in your vehicle in a traffic and you see somebody hawking banana, you just buy your banana, you open it and you start eating without knowing some of those chemicals get into your body. And those chemicals have been found to have bad effects, deleterious effect on our kidney, on our liver, even causing various problems. Even some kinds of cancers has been implicated. So we are trying to educate people to disease from using chemicals to ripen fruit. It's not safe when you now pluck those fruits when they are not ripe and you now apply chemical. Even our parents had natural way of ripening. You put them in bag, you try to create heat around the fruit and it ripens naturally. But because they want it to get to market within 2 or 3 days, they use chemicals. When you find, let's say for instance, you want to buy something like banana or plantain and you see that the fruit is very yellow but the stalk is still green, you have to be wary of such things. And then you see some of your fruit is so smooth, that normal brown mottled colors that you see on naturally ripened fruit, you don't see it, you see it so smooth and everything. You have to suspect that maybe such fruit has been ripened with chemical. And another advice I want to give people, try as much as possible to wash your fruits. Put them under running water. Use soap to wash the fruit very well before you eat it. Don't be too much in a hurry to eat your fruit, especially when you are in the car, you are driving, you are so hungry. You're not sure. Because if you eat it without washing, you if there are chemicals involved in the ripening, you might get some of them into your body. But if you go home and wash it properly, I believe most of the chemicals will have been washed out. One thing about abuse of chemicals, that's why we also spoke issue of weevils in beans. The pesticides that you're supposed to use to kill weevil, you're not supposed to apply it directly on the beans. You're supposed to spray the storage place and then put your beans in bag. But I've seen women adding it directly to the beans. The chemicals, the effect may not be immediate. Because when you start consuming it over time, you start developing all kinds of diseases. You find out that recently we hear about all kinds of cancers that were not even existing in Nigeria or in Africa before. We used to hear about people abroad having such diseases, but we have them here. Non-communicable diseases have become a major issue in Nigeria. Before, we only have infective diseases like malaria, all kinds of infections, communicable disease, which is more common in tropical area like Africa, but our health situation has changed. We have people coming up with all kinds of cancers, we have liver failure, we have all kinds of organ diseases that were not common before. It's because of a lot of chemicals, toxins have been going into our food, especially those selling palm oil. It's not good for you to add all these colorants and dye into your palm oil to make it more red. Some of these women, they don't even know. That's why education is very, very important. Don't add chemicals or dyes to your oil to make it red. You don't know. It may be somebody that will buy it and cook food. Your child will end up eating that food and you will have issues. So some of them, because when we went to the States, some of the women were surprised when we were telling them that they don't even know that it's injurious to their health. So that's why we believe that education is very, very key. When you empower people, they say my people perish because of lack of knowledge. So we try to let them know that these things you're doing, it's wrong. It's going to affect not just your health, it can affect the health of generations coming after us, not allowing cassava to ferment very well because of the issue of cyanide. The process of fermentation removes the cyanide. I just want to appeal to them to desist from doing such things because it's deleterious to the health, not just of the populace. Because let me tell you, there are something we call health indices. In Nigeria, they say life expectancy is so, maybe 55 years, 60 years. How does it come about? It's because when you have more people die, our health indices drop. So when we eat right, and we protect our health and then leave the rest to God. So I'm appealing to them to desist from such wrong practices because your own children could be affected. One of Fufu, when we got that alert, one of our officers in the states that was mentioned, they did some investigation. They think it's so wrong for you to put chemicals because they said they even put bleach to make the fufu white. What are you doing? I mean, you're damaging the body. When you put chemical inside your fufu, fufu is traditionally known not to be very white, and even that smell is the good thing. That it has one kind of smell that maybe they are trying to now kill the smell so that any people will eat it. But I think it's a very wrong practice, and we try to encourage them. Don't even apply chemicals to the food that you consume because chemicals are very dangerous. Another issue also we are trying to talk to the people about is the issue of using empty containers of chemicals or containers you have used to store petrol or kerosene. You just wash it and use it to store water or oil. No amount of washing can ever remove chemicals when they have leached onto plastics. Because some of those plastic containers, the containers for chemicals are usually mostly plastic. And when you store chemical or fuel or kerosene, somehow it gets absorbed on the plastic. So even when you wash it, you can't wash out anything. When you put oil back, the chemicals will leach back into the oil, and you find out that you're eating chemicals and you don't know. You think you're drinking water, you think you're taking palm oil, and you don't know that it's already contaminated with chemicals.
If you're just joining us, it's Health Affair on AIT. Next on the program is our nutrition segment.
Tiger nuts, also known as earth almonds, were one of the first plants cultivated in Egypt and traditionally used as both food and medicine. Tiger nuts are rich in a variety of nutrients and have been linked to several health benefits. Tiger nuts are rich in antioxidants, which are beneficial compounds that protect your body against aging and diseases like cancer and heart disease. Tiger nuts also promote digestion in various ways. Contents of tiger nuts are as follows. Calories 103 to 121 grams. Fiber 2 to 7 grams. Carbs 9 grams. Protein 1 gram. Fat 7 to 9 grams. Vitamin E 278% of daily value. Iron 13 to 40% of daily value. Phosphorus 9 to 11% of daily value. Vitamin C 2 to 8% of daily value. Magnesium 3 to 5% of daily value. Zinc 5 to 7% of daily value. Potassium 3 to 5% of daily value. And calcium 1% of daily value.
Our clinical segment will give you vital tips to stay healthy. Let's go there.
Everybody is responsible for his own health. It's not somebody else's responsibility. It's yours, first and foremost. And it's in recognition of that health medication is allowed, but within some constraints. It's just the same thing as saying you have freedom to live your life, but you are not free to kill yourself. So it's the same with self-medication is allowed, but we're not allowed you to poison yourself. And that's why, then the other reason why self-medication is allowed is that there are not enough doctors, there are not enough health professionals, there are not enough pharmacists or nurses to take care of everybody's health at every level. I mean, if we said everybody, before you take a medicine for headache, see a doctor, there'll be a queue. For 1 week, some people have still not seen a doctor anywhere. It's not Nigeria alone, no, but it's worse in our country where you have a very low doctor, individual, or pharmacist, individual, or nursing. You know, healthcare per capita is low. So that will even take weeks. And the person may have either been killed by the headache or by the malaria or by the diarrhea or something. So that's why. That's the second reason. And I'll give you the first one as a human right. Number two is to be able to ensure that given the constraints of healthcare personnel, we don't ask people to suffer unduly until they see a medical personnel. And if you see that for products that are allowed for you to use for self-medication, there's always a caveat. It says, if you do not get a relief after 2 days, go and see your doctor.
We welcome your contributions on how we can improve the nation's health sector and human lives on our perception segment.
The doctors, as far as I'm concerned, needs to be paid more adequately. If our politicians sit in the National Assembly and State House of Assemblies and they earn fat monies, how much more the doctors who cater to the needs of even the people at the grassroots level. And so if we really would want some level of improvement and not having other countries come into the country to take away our doctors.
This is where we draw the curtain on the program today. Please kindly support the program by advertising your health products and services at a very subsidized rate. My name is Oshuomowa Daniels. See you same time next week. Please keep staying safe.